Good afternoon, everybody. Thank you so much for joining me today. My name is Jonathan Modeste. I'm the Administrative Director of Operations for Massachusetts General Hospital Department of Urology. I'm also an adjunct professor here at Boston University School of Public Health, where I teach lean management in healthcare, which is a really great class that helps us dive into problem-solving methodologies and how to be really truly an effective and efficient organization. We learn about healthcare and beyond. I'm really excited to be here today to bring some of these strategies to you via this webinar. So today's focus of our webinar is going to be on implementing lean strategies in healthcare organizations, specifically why not, and using a common question to solve problems. Today's agenda, we're going to do an introduction to lean thinking, go over the anatomy of a problem, look at root cause analysis, 5 whys, and then follow up with some questions. Today is really meant to be some tangible tools that you can walk away with so that you can go back to your organizations or your personal life or whatever it may be and be able to implement some of these tools for yourself to be able to get to what we call as the root cause of a problem. Just a little bit more about me. In my regular role, I oversee operations for a subspecialty department at Massachusetts General Hospital, where we perform over 40,000 patient visits a year in a subspecialty setting, taking care of patients with urologic conditions, both male and female, across the gamut. I have the opportunity and privilege of working with doctors and nurses and physician assistants and nurse practitioners and administrative and clinical support staff to help provide care to patients and families that we serve. And really, we use lean thinking on a day-to-day basis, the tools that we're talking about today, to be able to be as effective and efficient as an organization as possible. And really, the root of this is being able to identify problems and get to the root cause of problems so that we can fix those. And that's what we're going to focus on today. I'd be remiss if I didn't start spending a little bit of time talking about the lean methodology. It's in our title slide, and it's something that we talk a lot about throughout this webinar and beyond. It's an approach and a philosophy. It's both an approach to work and an organizational philosophy that's set on methodologies designed to solve organizational challenges and improve results. Even more so, it's a culture of continuous improvement and people development. One of the things that I do in my first classes of the semester is actually talk a little bit about the lean methodology and some of the misnomers that come from it. A lot of people think lean, slim, narrow, trimming fat, and while certainly trimming waste is something that we talk about in the lean methodology, and that's something we'll get into in coming slides, it is by no means meant to be a resource-cutting measure or methodology. Our goal within the lean methodology is to really identify where there are issues, where there are wastes, where things are not working as well as they could be, and address those issues, fix them so that we can be more efficient and effective. In the long run, that may mean we are able to be more efficient with existing resources, or we could be more effective and efficient with fewer resources. But the true focus here in the lean methodology is to eliminate waste or things that are just taking up a lot of time and effort and energy in a system. And it goes well beyond healthcare. Actually, lean was established outside of healthcare in the Toyota production system, and that's really the root of this work is in industry and manufacturing. And we've been able to take it to healthcare, and we're going to take a few examples of that and show you today how we apply it. Very long story short, lean is not mean. It's not meant to be downsizing or outsourcing or just working faster or just common sense. It's really a true methodology that I look forward to be able to sharing with you a little bit today and hopefully maybe in additional opportunities in the future. So the question is why? Why are we focusing on lean and why is it important enough for you to take some of your time today to be able to talk about this? Well, within healthcare and beyond, it helps us reduce customer wait times and errors and standardize workflows. Certainly, reduced wait times and errors within the healthcare system is something that all healthcare organizations strive for. It reduces unnecessary workload, duplicative work, and/or rework. It improves handoffs, it increases productivity, and reduces inventory. All things that, again, in healthcare and beyond are relevant to being able to be efficient and effective in the work that we're doing. A lot of the examples that I'm going to give as we talk about today are specifically related to healthcare operations, the provision of care to patients, but certainly these theories, these themes, and the examples that I'm giving can carry well beyond the healthcare operations standpoint and be carried to things that are relevant directly to you if you work outside of healthcare. It focuses on quality, satisfaction, and efficiency. Truly, our goal is to provide incredible patient care to the patients and families that we serve, and we are trying to do that through this methodology. Quick quote here from Toyota. At Toyota, we get brilliant results from average people managing brilliant processes. Others get average results from brilliant people managing broken processes. And while I would like to make one differentiation in this quote and say that I think the people that I surround myself with and I have the privilege of working with are brilliant people, are amazing people, this quote just talks a little bit to the ability of lean to elevate the sum of the individual parts, right? So together as a sum, we are greater than the individual parts, and we can see that play out well beyond healthcare. Take all-star teams, for example. Some of the best teams in sports are ones that are a bunch of people coming together that may not all be all-stars, but when you get an all-star team of people together, those brilliant skill sets not always produce the best results. And our goal here is to take a group of individuals who are dedicated and passionate about providing healthcare delivery and supporting healthcare delivery and actually help support brilliant processes. Another thing I want to focus on before I move on is the idea and theme in Lean that people are not the cause of problems, bad processes are. And this isn't something that I want people to take lightly. I want you to think about this. People are not the cause of problems, bad processes are. In the midst of a crazy day at work, when you are trying to see 100 different patients and doctors are working really hard to notate their visits and enter prescriptions and orders and meet the patient needs and demands, at the end of the day, it's very quick to say, why aren't you doing your job? Or why isn't this working well? Or why isn't it just going the way we want it to? What we're going to dive into in the coming slides is how to get to that from a process perspective. I can tell you in the organization that I work, I've had the privilege of being able to hire the majority of people who work in the department at this point, and none of them interview and say, I want to cause bad things to happen. They are all passionate about providing great healthcare, but unfortunately, healthcare and organizations as a whole are sometimes built to not support efficient and effective processes. And in order to get to the root of those problems, we're going to use some of these tools today. We need to start asking really important questions, and we're going to get to what some of those questions are. But again, people are not the cause of problems, bad processes are. So before you try to turn to one individual about why something isn't working, please make sure we look at the process. This slide here talks a little bit about the core of Lean in healthcare. So obviously Lean started in manufacturing. It started with the production of widgets, cars in this case, in the Toyota production system, and is carried through industry and manufacturing, and over the last many years has made it to healthcare. But many people ask, well, how does this translate to healthcare? And really it does it through these three main tenets. So the goal of Lean in healthcare, the core of it, is to focus on patients, not necessarily the hospital or staff, and design care around them. If you design care that really focuses on the patients, you're actually going to be able to check the boxes that keep patients, or that keep the hospital and staff satisfied and productive and successful in the long run. The other piece of this is to identify the value for the patient and get rid of everything else. You want to eliminate waste. What is ultimately valuable to the patient? And sometimes that's difficult to do in healthcare just because there's so many different things happening and there's so many different things dictating kind of the care that a patient needs, but really stripping things down to bare bones and saying, what does the patient value? And then minimize time to treatment through its course. So if all of this work that we're doing to identify problems and eradicate waste allows us to diagnose and treat patients quicker and faster and more efficiently so that they can return to their baseline function or their normal quality of life, we've been successful. So we talk about value in healthcare. Important to keep this in mind. So the definition of value, it's what the customer is willing to pay for. It transforms a product or a service. It's done right the first time, and we keep the ultimate customer in healthcare as the patient. These are two different ways. You see these two graphics at the bottom of the slide. These are two different ways that we can look at value in healthcare. We see the 6 aims on the left as effective, efficient, safe, timely, patient-centered, and equitable. And on the right, we also see another way that we've been able to define value over the years is achieving high patient satisfaction while delivering high reliability care, managing populations effectively, all while managing cost. These are all things that patients weigh in the balance as they're trying to figure out what drives them and what they find most valuable in healthcare. If we break this down a little bit more, it's about adding value, and we talked about patients, employees, and organizations. So what is it that these three kind of groups of individuals or groups value? So patients, they value quality, experience, and cost. They want great quality healthcare. They want it in a way that makes them feel good about the care they're receiving, that they trust the providers and the system that's supporting those providers. And in the world of modern healthcare, where cost is such a big piece of the patient's experience in healthcare, they want to do it at an affordable cost. Employees are looking for meaningful work and a positive work environment. They're also looking for respect. These are the things that they value as they look across the system. And organizations as a whole, they value their mission and in some cases their ability to produce margins so that they can build their programming and build new resources and improve their infrastructure. They also really truly value their reputation. The interesting thing about this is if you look at the employees and the organization buckets, if you check the boxes and meet the things that patients value, the downstream effects often meet the valuable aspects of employees and organizations. If we're providing great quality, a terrific patient experience at a reasonable cost that patients are allowed to actually access care, you're able to achieve the things that are valued by employees and organizations downstream. So the question we have here is, in lean methodology, in lean thinking, how can you increase value? And as we move through the webinar slides here, I think it's important to focus on some of the things that detract from value. Core to the lean thinking is the 8 wastes. And as we look to identify problems and really break down what their root causes are, it's important to know what some of those problems or manifestations of those problems could be. So as we look at this, we say that there are 8 wastes in healthcare. That's known as an acronym called downtime. And that stands for defects, overproduction, waiting, not utilizing employees, transport, inventory, motion, and extra processing. So defects, very simply, errors, things that go wrong over the course of the day. Wrong coding on a requisition, incomplete, incorrect info. If you're looking at grant submissions, it could be wrong information on the grant, wrong information on documentation. It could be mislabeled specimens in the world of healthcare. Overproduction, doing more than needed. This is something that we do on a regular basis. Extra reports, unnecessary info that's sent automatically, printing in advance. One of my favorite things to focus on in overproduction is the printing of charts in the world of electronic health records. How many of you are in healthcare organizations and still walk into a doctor's office and get a piece of paper? All of that printing, if that's something that could be done electronically, is overproduction. One of the most common things we see in healthcare, especially in healthcare delivery, is waiting. Just waiting or delays, waiting for the appointment in the waiting room, waiting for the doctor to come into the exam room, waiting for lab results, just waiting. Not utilizing employees, this is one that's actually often overlooked, and part of the lean methodology is attempting to deal with this directly, and that is the failure of staff and organizations to use the ideas and skills of their incredible staff. I can tell you the staff I have the privilege of working with, they all have incredible ideas. Many of them are on the front lines on a day-to-day basis and have great ideas on how things are working and how they're not. And our goal is to be able to go to these individuals and say, how can we do this better? Or what works for you? Or how should we design this so that we can recognize that they are the best source of fixing issues. Transport, the actual movement of people and material. Transport between campuses. I can think about many different buildings at Mass General Hospital or in other hospitals in the Boston area, just separate buildings or campuses all together. The hand delivering of invoices, movement of files, and so on and so forth. Inventory is another big one as we look at too much material, having too much material on hand and actually having to store that. Any inch of space in a clinic setting or a healthcare setting that is not used for patient visits is a missed opportunity to be able to see a patient or take care of patients. Stocking that inventory is at a huge cost to organizations, and our goal is to be able to strike some of that down. Motion, unlike movement or transport, motion we say is movement by workers. That is actually the searching for something, the moving of things around because it's not close by, as opposed to the transport of from one place to another. Transport and motion are similar in nature, but they have distinct differences. And then extra processing, simply redos. Oftentimes extra processing can be driven by defects or errors, but extra processing can also just be built into processes. Thinking about having to provide answers to questions multiple times at triage, or having to answer or ask questions, answer questions that are coming out of the electronic health record. Updating your medications multiple times because that's not getting fixed. Those are all things that contribute to extra processing. So with this foundation, with this, this knowledge of the 8 wastes, let's move forward to actually defining what a problem is as we look to move forward with these slides. So what is a problem? Very simply, a problem is a gap between the current state and the ideal state. Something to keep in mind as we're looking at problems. Problems have manifestations. Problems appear and present themselves in one way when in fact the root cause may be another. So while you may be focusing on what you think is a problem, it's really important to pause and ask yourself, what is the actual problem we're looking at? Because if you whiff on the problem, the chances are you're going to solve something that isn't actually an issue. We have an example of this. Oops. Uh-oh. Car's gone. So this example is a tad bit tongue-in-cheek, but I think it really helps summarize why it's really important to be able to define your problem and not whiff on it. Understanding what your actual problem is, defining your problem well, is the start to being able to get to the root cause of it. If you just come up and think that this gentleman is trying to push his car over the ledge of a cliff, you're solving the wrong problem. So, what are the contents of a well-defined problem? A well-defined problem has a gap, clearly identifying a gap that exists. Is there too long of wait days to be able to see a new patient with cancer? Are patients waiting too long when they come into clinic? Do they have to wait an hour from their scheduled appointment time to be able to see patients? Do they have to wait too long for their lab results or for a return call or for a prescription to be processed? These are what is the actual gap that exists. Being able to actually quantify that gap is even more valuable. Time frame, location, and trend. When and where is the problem first observed, and what kind of trend is it following? Oftentimes, problems have patterns. Being able to identify what those patterns are and identify where they're occurring in the process will help you be able to identify potentially how to fix it in the future. What is the impact of that problem? Quantify the gap, whether it's cost, time, quality, patient experience, environmental, personal, you name it. Quantify that gap. It's really important to be able to state what the cause of the problem, what the rendering effect of that problem is, and the importance to the individual, to the organization, so that you can better understand the urgency. Being able to define a problem effectively gains alignment, ensures success, and is really it allows you to create a rallying cry. It's something that's agreed upon by all of the staff that you're working with and has you working along a shared goal. If everybody's working on a slightly different problem, it's going to be very difficult to solve that problem in the long run. And it also allows you to refine information based on what you've learned. One of the things that I tell students when we're talking about in class, class is based off a live project, and they're going out into organizations and they're actually identifying real problems and trying to solve these through these live projects. And the problem statement that starts at the beginning of the semester always evolves over the course of the semester, because the reality is, as you dig into a problem, as you learn more about the manifestations of that problem and the actual root causes, it allows you to circle back and refine it. And that is something that I will also say. The first way you define a problem is likely, and probably shouldn't be, the final iteration of that problem statement. So, onto the guts and the root of what we're going to be talking about today, determining the root cause. We've talked about defining the problem. What we're looking at here is a problem-solving funnel. This has been socialized by James Womack and lean.org, and I think is a really great way for you to focus on how to go from a pretty broad manifestation of an issue and narrow it down to what we call the root cause of the problem. So you have this initial perception of the problem, that is, patients are waiting too long in clinic. From the time that the appointment is scheduled at 12 noon to the time that the appointment occurs at 1 p.m., they're just waiting too long. I'm not sure many of you would be thrilled if we said we were going to start today's webinar at noontime and didn't start it until 1 p.m., but oftentimes patients arrive to clinic, and that is what happens when it comes to the receipt of their care, and we don't want to do that. So that is a problem. That is our perception of the problem. We want to clarify that problem. Is that specifically happening in a particular area of clinic? Is it one section of the department? Is it one specific doctor? What is that problem? And the best way to do that, there's a term on your slide right now that says go to the Gemba and understand where the work is being done. Gemba is one of the most commonly used terms in lean methodology. And what we are looking to do is go to the place where the work is being performed and actually observe what is happening. You're going to the place, you're observing, you're seeing what's happening, and it allows you to focus on the process. While you were doing that, you obviously want to be respectful, and pulling from one of our earlier slides, you want to blame the process, not the person. You want to understand where things are failing, where things are going wrong. This is actually a real problem. Wait times are a real problem that we struggle with on a daily basis in the department, and something that admittedly we're trying to solve. One of the ways we've actually sent our teams to the Gemba is had project management staff stationed outside of exam rooms with doctors to be able to observe when the doctor goes in, when they come out compared to existing times, the flow, where they're moving, understanding motion and where there may be waste. And once you focus on the process, you want to determine the root cause. You want to perform that cause investigation. Why is this happening? How do we get to it so that we can actually fix the problem? As I noted, that is what we are going to focus on moving forward. I had mentioned something a little bit earlier about the manifestation of a problem. Again, in addition to making sure you're not whiffing on the problem, you do not want to tackle the way the problem manifests itself. If I tell you we're going to try and fix wait times in the clinic, there are so many different ways or so many different things that could be contributing to wait times. Again, wait times in this example, it's the manifestation of the issue. In this case, it's a Band-Aid. Trying to fix wait times without doing a deeper dive to better understand what's going on is simply putting a Band-Aid over the manifestation. And we all know what happens when Band-Aids get wet. They fall off. It's like trying to use a Band-Aid to close up a major significant cut. The other reason why you don't just want to solve the manifestation is that you were going to be firefighting all the time. You were going to be chasing ghosts. You were going to be constantly trying to put out fires. And the reality is while firefighting is an incredibly effective method of solving a problem that you have absolutely no way of controlling, not knowing when it's going to pop up, it is not an effective way to manage operations, and it is certainly not an effective way to make sure you are able to provide the best care possible. Fixing the manifestation of the issue means you're going to have to continually fix that issue over and over and over again, to a point where it leads to this as being your key problem-solving method. You don't want to be forced to bang your head against a wall. You want to feel like you are making headway in reducing the manifestation of these issues. You want to fix the problem. You want to reduce waste time. So instead of banging your head here and using this stress reduction kit as your problem-solving methodology, I am going to propose a couple of tools. Those tools are coming up in the coming slides. Very first tool we call a fishbone diagram. So a fishbone diagram, also known as an Ishikawa diagram or a root cause diagram, very much looks like a fishbone. You see it right here. It has 6 different categories kind of stemming from the backbone of it, and at the head of it is the problem. That problem at the head is your manifestation. That is extended wait times lead to patients being unhappy. That is delayed lab results prevent us from treating patients in a timely manner. And what we have on through the rest of this diagram are 6 different categories that are meant to be all-encompassing categories for various manifestations or problems that we may see pop up throughout the course of a root cause analysis. Those include machine, method, measure, materials, people, and environment. Machine being infrastructure, technology, other machines that may be used. Method, we're referring to process. Measure is measurement data available to you. Materials are inputs that you may use, materials that you may use throughout the process. People is anything involving manpower or people or interaction, and environment is the environment around you. One quick thing to note, this fishbone diagram is actually available to you as a download from today's webinar. You can actually download it from the webinar and be able to use this anywhere you want. I actually keep a stack of these available to me in my office and in my bag when I'm running around from one place to another, because you never know when you're going to want to dive into a root cause analysis and just be able to jot down in an organized fashion things that may be contributing to a problem. So how do we use this thing other than being able to look at a very pretty diagram of a fish? So the steps to fishbone diagramming are relatively simple. And what we're going to do is we're going to go through these steps and we're going to actually walk through a live example of a fishbone diagram. So step number 1 is to write 4 to 6 main categories on a whiteboard, flip chart, or document sharing system. I often like to use flip charts. It allows me to pull it down off the wall. You can use a whiteboard and take a photograph of it afterwards. But you want to write down these 4 to 6 categories. I'm going to step back in my slide once. These are the 6 categories we're referring to. I will say this. It doesn't matter what the categories are so long as the category summaries are related to what you're putting into the fishbone diagram. So if you're not attached to these 6 categories, I'm not going to be offended. I don't think anybody will. The goal here is to be able to give you categories for you to organize your thinking as you start to work through the different things that could be going wrong with your process. You want to write the effect of the problem at the head of the fishbone, which is that far right problem box that we have here. So just simply write your problem. If you have a well-defined problem statement, you could put it there, or again, you can just simply write the problem as it manifests itself. Wait times are too long, patient experience is reduced, you name it. 3, you want to list all categories of the problem. We call these effects in the various categories. List all the possible causes of the problem. We call these effects in the various categories. And we're going to walk you through and show you how to do this momentarily. Next, you want to prioritize the causes that need to be investigated further via data collection, beta test, etc. I will say that you are going to often come up with a number of different problems. If you look at the fishbone diagram itself, there's 4 times 6, there's about 24 different examples you could come up with just on this template alone. You may stop there, you may stop before you're done, but at the end of the day, the goal is not to tackle every single one of those problems. You want to hone in on specific issues as you think about that funnel that we're talking about. You want to go from very specific to very broad, to more specific as you're looking to solve the problem. So you want to list all those possible causes, but you also want to prioritize the causes that you're going to focus on. And that can be done a number of different ways. Oftentimes people identify the top few items through multi-voting, consensus, general agreement. Your goal is to be able to identify most specifically which ones you feel like you can work on. A quick tip from me, I would actually focus on the ones that are the lowest hanging fruit or the easiest to tackle. If you can find the first 2 or 3 things that actually allow you to get some quick wins to address really quickly and put in some quick solutions and show benefit and effect from those interventions, you are going to start building momentum that's going to drive performance improvement. So again, pick the one that you're most passionate about or the one that you think might be easiest to tackle. And then brainstorm top problems through data collection or conduct a 5 why analysis. We will walk through a 5 why analysis in future slides, but we are going to start with actually a live example of a fishbone diagram. So as you see here on the screen, we have a fishbone diagram that has a problem at the head of the fishbone. Visit wait times are too long, leading to extreme delays and resulting in unhappy patients. Again, I've used this example, relatively simple example, and have carried it so far throughout the webinar. We're going to continue on with this so we can dig deeper. So you're going to list different causes of that problem. What is one of those causes? Could be that documentation takes too long. So we have electronic health records in place. The documentation within those health records take too long, and it causes the providers, whether that's a doctor, a nurse practitioner, a physician assistant, a nurse, to have to be documenting between patients, and that leads to delays. Patients are double booked. How many times do you see that patients are double booked? For those of you in healthcare operations, patients are constantly trying to gain access. We often have a capacity demand. The equation doesn't quite work with many more patients seeking care than we have appointments to give them. And just to be able to get those urgent patients in, we have to double book them. Well, if it's a double booked appointment, it's going to lead to delays. This could be both a machine issue, as you see here, because the system, the electronic health record, is actually allowing you to double book the patient. Or it could be an environment issue, because the environment around you, the culture around you, is that we are always going to double book patients. So this is an example of a topic that could actually fit into 2 different categories. Under method, we have medical assistants don't know when a patient arrives. So if many of you work in a clinic location or a setting similar to the one that I work in, we have 14,000 square feet of clinic space. It is very difficult when the medical assistants are working hard to keep up with a 30 or 40 patient day to be able to know when those patients arrive to be roomed. So if the patient is busy rooming another patient or is back in the clinical setting and the waiting room is not easily accessible, perhaps the medical assistant doesn't know when the patient arrives, and because of that, they can't room the patient, which then causes the patient to wait in the waiting room, even though they've showed up on time for their appointment. Another example in method, doctors or other providers don't know where to go next. So oftentimes in a clinical setting, doctors, nurse practitioners, physician assistants are working out of more than one room. So when they walk out of one room and they don't know where to go, that could potentially lead to delays. That's also a process issue. Cumbersome order entry as part of a method issue. So cumbersome order entry, doctors or other providers having to put orders into the system so that the patients can have what they want. That often takes time. It's tied to documenting. It could also fall under machine. What I would say is I'd actually pause here and say this is a really good example of something that might be in a different category than you think it should be in. I'm listing them based on the categories I thought they fit under, but again, the goal is not to pick the right category. The goal is not even really to have a very specific category label, so long as you are able to organize your thoughts accordingly. The value in this is not the categories themselves, it's the specific effects that you are identifying through the performance of, or through the completion of this fishbone diagram. Another example, quality measure visit requirements. For those of you in quality improvement in healthcare, you may know that there are a lot of requirements associated with quality and quality of care, and many requirements that are required as part of documentation. Sometimes meeting those requirements take time, and because of that, we're delayed. High volume clinics in the measurements, similarly and tied to patients double booking, just having a high volume clinic and being able to see and give the patients the time that they need so that they feel that their time is being valued and that they're able to get the care that they need could be contributing to delays. A common one that we hear from our doctors and other providers, not enough exam rooms. So if a doctor has 30 patients scheduled and they're spending 15 minutes with each patient, but they only have one exam room through the day, they are not going to be able to see the patients in an efficient and effective manner, and that could cause backups. So you want to make sure everything is right-sized, but not enough exam rooms could be another thing contributing to the reason a patient is waiting an hour extra in the waiting room. Supplies not readily available, so similar to one of the wastes in motion that I talked about earlier, having to run around to gather supplies after the visit already started or to locate them, that can lead to delays. Multitasking. Who doesn't multitask? I'm the king of multitasking. Oftentimes somebody's asking me a question and I've already moved on to my next email. This is something that is always happening, and especially in the world of the multiple components of clinical care, multitasking is something that happens all of the time, right? So a patient is asking a question, but somebody is actually documenting the last answer to the previous question that was asked. Doctors are trying to enter prescriptions, nurse practitioners, physician assistants trying to enter prescriptions or orders for CAT scans or ultrasounds or x-rays. All of these things have to be done during the visit, and that multitasking could potentially lead to delays. In the world of right-sized staffing and trying to manage staffing levels, I know we have this problem on a regular basis. Our medical assistants, they work so incredibly hard, but at the end of the day, they're often supporting multiple doctors, and multiple doctors means multiple panels worth of patients, and that just means that they have to work with competing demands throughout the day, and their attention can be pulled. And sometimes that means that could actually contribute to one of our earlier problems where they don't know that the patient has arrived. So because the medical assistants are supporting multiple doctors, they may not be able to room patients in a timely manner, or patients might get overlooked in the waiting room. MDs are documenting. We've talked about this ad nauseum, and also fits into the machine. So another example of an effect that could fit into multiple different buckets. Another common one, Boston area traffic is the worst it's been in 20 years. Take it from somebody who has to commute over an hour to work every day. But at the end of the day, patients are doing their best to arrive to clinic on time. Sometimes they rely on public transportation, sometimes they rely on relatives to drive them, sometimes they just rely on the roads being clear, and that doesn't happen. So patients arrive late, and that can throw off waiting or a timely execution of clinic. We have an elderly patient population. I know in certain specialties, just the speed at which folks move can contribute to delays. And frankly, we live in a complex care environment, and that complex care environment just means so much stuff has to happen during a clinical visit and surrounding it that it could lead to delays of care. So we have a completed fishbone diagram here with examples that span the gamut of the 6 different buckets that we talked about. So what do we do with all this information? We've now broken it down from what we saw as patients waiting too long for their visit, and we've narrowed it down to what we think are major effects, but those effects still are not root causes. Those effects are still, in many cases, manifestations of the issue, more specific manifestations of the issue, but still manifestations of the issue. So what do we do now? And this is actually my favorite step in the process, is to ask 5 whys. Think about being a little kid and just repeatedly asking your parents why, until they get so annoyed with you they say enough already. The reason they're getting annoyed with you is because they've answered the question as many times as they can, and there's just no other way to answer it. Or you're being really successful at being annoying, but hopefully it's because they just can't answer the question anymore. Ask why 5 times. So 5 why analysis allows organized brainstorming to methodically determine the cause of a problem, the true root cause of a problem. Most often, teams observe a symptom of the problem rather than the problem itself. And if we go back to that video that we saw earlier, the symptom, the manifestation, what somebody was seeing was not actually what the problem was. And we want to make sure that you're not accidentally pushing a car over a cliff. So, 5 why analysis, pretty straightforward, 3 easy steps. The first is to list the 2 to 5 potential main causes of problems identified from the fishbone diagram. I go back to the fishbone diagram steps. Identify your top causes. Identify causes that you feel like you have control over, because there's nothing more frustrating than trying to solve a problem you can't control, or trying to solve an effect that you have no control over. So pick something that you're either passionate about or you feel like you have control over. and use the information to start a plan for additional data collection and testing to improve. I will say as you're trying, I'm going to go back 3 slides, as you're trying to pick a problem, you probably don't want to focus on that problem under environment that's the elderly patient population. You're not going to fix your patient population. It's not controllable. There are things on this list that are much more controllable, and we are going to move forward with those under a 5Y example. Just a quick quote from Taiichi Ono, who is one of the founding fathers, if you will, of the Toyota production system and the lean methodology. Quote, "To tell the truth, the Toyota production system has been built on the practice and evolution of this scientific approach. By asking why 5 times and answering it each time, we can get to the real cause of the problem, which is often hidden behind more obvious symptoms." So here is your 5Y analysis. It is a very simple grid. Again, this grid is available for you for download. I suggest you download it and you can use it in pairing or in partnership with your fishbone diagram. It gives you up to 5 causes. You don't always need to use all 5 causes, and up to 5 Ys per cause. I will say you will not always need to get to the 5th Y. Sometimes you can get to the root cause, which you feel is a real tangible problem that you can solve before the 5th Y. So the big question is, which Y do I start with? It doesn't matter, just start somewhere. And like I've said, the goal here is to make incremental improvements. If you pick off one of the lower hanging fruit, one of the easier effects that you've identified in your fishbone diagram, and even if it requires minimal effort to address, but you're able to address it and show that it affects change, you will build momentum and a culture for improvement within your organization that has people running faster than you will be able to. And that is how organizations truly succeed in the long run. So it doesn't matter where you start. Just start somewhere and try and fix one of the problems you've identified. So, in the example of this, patients arrive late. There are a lot of different reasons why patients arrive late, but I am going to ask why. Because they don't know they have an appointment. Why don't they know they have an appointment? Because they forgot they had an appointment. They might have scheduled it 12 months ago and they forgot that they had it. Why did they forget they had an appointment? Because they did not receive a reminder call. Well, I could stop here, but if I assume they did not receive a reminder call, my knee-jerk reaction would be to implement a reminder system. But that's funny. I have a reminder system. So the question is, why did they not receive a reminder call? Because they didn't answer the reminder call. Interesting. Why didn't they answer the reminder call? Because they didn't recognize the phone number. So this is a real problem that we have dealt with in our own operations, right? We call to make reminder phone calls, but in the world of constantly getting phone calls from solicitors and everything on your cell phone these days or on your home phones, I ignore calls that aren't in my phone book. So the question is why didn't they get the reminder call? Because they didn't recognize the phone number. So here, they didn't recognize the phone number. This is a tangible, solvable problem that we can tackle in a number of different ways. I'm sure some of you have already thought about potential ways to do it. Some of the things you could do as you're looking to solve these problems is potentially give them the number that your department is going to be calling from so that they can put it into their cell phone at checkout. Potentially register your phone number some way. Potentially move to text reminders, which is another way to be able to back off the phone call issue where people aren't answering calls. You get texts all the time, you end up reading them most likely. So there are a number of different ways to solve this, but this is a tangible thing that we actually have control over. And it's a lot easier than trying to boil the ocean with patients are arriving late. Here's a second example of root cause of 5Y analysis. Patients are double booked. Why are patients double booked? Because the MD schedule doesn't have enough slots. Why doesn't the MD schedule have enough slots? Because demand exceeds capacity. This is something that all healthcare organizations are dealing with. Why does demand exceed capacity? Because the department doesn't have enough providers. Here, we've kind of gotten to we have gotten to a root cause in just 3 Ys. The department doesn't have enough providers. We may need to look at being able to hire additional providers to meet our demand. This, again, is a root cause. It's a more specific reason as to why the patients are being double booked and something tangible. I will say you can take different spins through 5 whys and end up at different endpoints dependent upon how you answer the question. So if you feel like you've answered a question and you've gotten to an endpoint, or what we call the root cause, and it's something you don't have control over, I recommend you go back and try answering the 5 whys again slightly differently. You may end up at a different endpoint, and it may help you in the long run. Identify what it is you're going to tackle. So, another couple of quotes here. Making this logical sequence clear and explicit enables individuals and teams to concentrate on important matters and to discuss them in productive terms. This is from John Shook in Managing to Learn. This is content available to you, lean content that's readily available in a number of literatures. And the second quote, 5 whys equal 1 how. And that's another quote from Taiichi Ono. So the major takeaway from today, if you walk away with any key takeaways, it's ask why. And the reason you want to ask why is because it truly is magical. It leads you to being able to identify the true root cause of problems that you can have effect over, and you can actually cause improvement work to be performed on. And your ability to ask why will allow you to be successful as a change manager, an operational professional, a staff member in the long run. I thank everybody for joining me today, and I'm happy to answer any questions that people may have. So how can healthcare organizations prepare to be better suited to implement and sustain a lean culture? How do I get started? That is a really, really great question. So, the lean culture is one that is still working its way into healthcare. And again, I spent the first few slides kind of dispelling some of the misnomers about lean healthcare, and and that it's not lean or mean or trying to cut out fat or anything like that. What I would say is start small. If you can start with these tools, right, such as a fishbone diagram or a 5 why analysis, you're actually starting to build the foundation of lean culture within a healthcare organization. If you can teach people to pull out a fishbone diagram, or even think about a fishbone diagram as you're trying to solve a problem, it actually builds the foundation that allows people to focus on the process and not the people. And the lean culture is really about the former, focusing on the process, like I mentioned earlier. So, you won't always need these fishbone diagrams and this structure. Sometimes people just think about it. When I am now working through a problem, I will do it in the methodology of kind of executing a root cause analysis or a fishbone, but sometimes just pulling out the fishbone helps teach others. What I will say is, in the organization that I work in, I'm not actually focusing on key lean terms. I'm trying to pull in the methodology itself, and that is the true problem-solving method on how to fix issues and eradicate waste. Any other questions? Can activities that take time and effort and do not directly affect patient outcomes, like educating family members on the condition of a patient, be value added? Yes. So any activity that's addressing how to fix a problem can be value added. And I also said a lot of the examples that I'm giving you today are operationally based. But these lean methodologies can be done from the side of the patient who is receiving care and trying to identify ways to provide additional information. Hope that answers your question. Do you have any examples of healthcare organizations that implement lean management well? So I can speak mainly on my organization. I do know that there's a number of organizations around the country that are taking the lean endeavor. I know that there's a very robust lean program at UMass Memorial in Boston. I actually had the privilege of learning from a number of their practitioners there and through the BU School of Public Health. And then there are many other clinics that are or healthcare organizations across the country that are implementing lean methodology. I believe in my research, I've seen Cleveland Clinic doing a great job, at least at focusing on value and things like that. But again, my knowledge is limited of some of the other organizations. I can tell you we're working hard to build this methodology into our work at Massachusetts General Hospital, specifically within our department and others within the organization. What are the most common mistakes in implementing lean? This is a really great question. So I think one of the most common mistakes in implementing lean is really focusing on eradication of waste without building the ability to talk about that. Our goal is to be able to collaboratively identify where there are issues. One of the other mistakes in implementing lean is not going to the folks who perform the work on a day-to-day basis, not going to the Gemba and working in isolation and trying to fix problems in isolation. It is so important that this is a collaborative effort, and I think if it can be collaborative and communication is clear, your lean endeavor will be more successful. I will say this takes a lot of time. I've been at this for many, many years within even a small microsystem, a small department within Mass General. And we're still, hitting, jumping hurdles to try and be able to implement this methodology. So it is a journey, and it is one that requires folks to really focus on the process and make sure they are inclusive, and helping people understand where there are opportunities for improvement. How do you get buy-in to implement lean strategies from staff and clinicians who are unreceptive to change? How do I convince my leaders and associates to practice lean? So I'm going to start with the latter question first. How do I convince my leaders and associates to practice lean? The way I've done this in the past is a tad bit more grassroots. And we've seen examples of top-down lean implementations and kind of grassroots, bottom-up lean implementation. There is no better way to convince folks to practice lean than to show the effect that it can have on your day-to-day operations, your work culture, and your problem-solving abilities. People want to be able to solve problems. Most people who are unable to solve problems just aren't equipped with the tools to be able to do it. So even focusing on the 2 tangible tools that I gave you today to walk away with, and being able to get to a problem and solve it quickly, and showing people that can then spin into sustained improvement, that is how you convince people that lean is important. Again, I've said it before, I don't walk around using the lean lingo on a day-to-day basis. I don't walk around with, I consider myself a servant leader to the department and the folks that I work with, and my goal is to facilitate, and I'm using lean as a methodology to facilitate performance improvement. So our way to get buy-in is to show people that it gives people the ability to identify problems and solve those problems and leads to improvement. Can a process devolve from efficient to inefficient over time? If so, how can you continually evaluate a process to ensure they are efficient and lead to continuous improvement? That is a great question. Not only can processes devolve from efficient to inefficient over time, sometimes the countermeasures or fixes you put into place may make things less efficient than they are right now. This is why, and if we have the opportunity to talk more about this, PDSA cycles and sustained change and slow incremental improvements, there are methodologies out there that train you to actually focus on fixing one piece of one thing, circling back and fixing it again and again and again until it gets better and you've basically maximized your improvement. So I would say no change, no implementation to fix a problem is ever one and done. You should always be circling back. Processes can devolve, especially in the world of technology, where added technologies are changing the environment on such a rapid scale and such a fast pace. Processes can become less efficient because of implementation of new technologies. So it is always, if you were sitting back on your laurels and allowing a process to go unaddressed for too long, I would say there is a high likelihood that there's inefficiencies developing. So it's always helpful to look at them. Once you identify the root causes, how do you make sure changes you implement actually fix the problem and don't create new problems? Another really great question. So regular feedback loops, making sure that you have data. So when I'm working through the lean methodology and teaching the class, one of our entire classes is actually focused on data. So it's really important to know that this can't be done, this can't be measured without being able to collect data. So, we look to make sure that there's some sort of baseline data or observational data that we're able to circle back to and say, pre and post change, whether this was a large change or a small change, how quickly are things happening? Are things getting fixed? And we're comparing that. And it can be crude data. It doesn't have to be fancy, analyzed, statistically significant data. The goal is just to make sure that you are able to measure whether or not you've made progress. How large does a company have to be to practice efficient lean management? You could be a company of one if you want to be. I think the larger the organizations, the harder this is to implement on a regular basis. However, and spread it to multiple people in the organization. So oftentimes lean is done at a practitioner level and then kind of spreads like wildfire from there. So if you were trained, if you train yourself on lean methodologies and you pick up some of these tools, you can then spread it. I would say, I like to start small and go bigger from there, and that's what I've seen other, at least healthcare organizations in the area do. They identify pockets of opportunity to implement the methodology, they train folks, and then it spreads from there. Are there any challenges to implementing lean strategies that are specific to healthcare? Yes. So we talked about the 8 wastes and root cause analysis and focusing on things that you can control. What I will say is this: healthcare, because it is patient-focused and managed, and there are so many stakeholders in healthcare. Let's talk about insurance companies and regulatory bodies and policies and things like that. There are so many things that are contributing to waste in the healthcare system that prevent us from being efficient, but are mandated on a policy level. And those are things that we don't have control of, right? And obviously policies are designed to be able to keep people as healthy as possible and keep care equitable. And there are so many other reasons that policies are in place, both ineffective and effective policies. But I would say, and this is one of the takeaways I regularly share during the course of a semester, is healthcare is a particularly unique beast when it comes to lean management because we can't just eradicate all waste. Some of that waste is just necessary and we have no way of changing it. How does lean compare to other improvement processes such as Six Sigma? What are the best lean resources? So that's a really great question. Lean Six Sigma is often, bear with me for 1 second. Lean Six Sigma is often used interchangeably. I actually have a great slide that I don't have with me that shows the differences between Lean Six Sigma. I actually find them to be complementary. So Lean is looking to tackle issues based on waste and process. Six Sigma is looking to eradicate error altogether and eliminate error from a statistical standpoint. They both tackle processes and process improvement from slightly different methodologies. So we use PDSA and Lean, we use DMAIC and Six Sigma, but oftentimes putting them together, if I have the opportunity to share the slide, I will. But if you put them together, actually, Lean tackles some of the shortfalls of Six Sigma, and Six Sigma actually tackles some of the shortfalls of Lean. Six Sigma being more data focused, Lean being a little lighter on the data aspect and being more process focused. Best lean resources, I think one of the greatest lean resources that I've found is actually lean.org. There's a lot of great literature on lean.org, and that's been the foundation of a lot of, and I have no disclosures here, this is where I go get a lot of my information. James Womack is actually the father of modern American lean thinking. Lean is not a term that was used in the Toyota production system. Toyota production system was what they referred to lean as. But James Womack has really made it tangible here in the US and has spread it broadly. A lot of his literature and that of his colleagues is available through lean.org, such as the book Lean Thinking and things like that. So you could grab resources there. Any other questions? No? So with that, I just want to thank everybody for spending your lunch hour, or if you're on the West Coast, early morning hours with us. And I hope to have the opportunity to be able to share additional lean methodology and tools with you in the future. Thank you so much for joining us today, and I hope you have a wonderful day.